usually when I talk about leadership, I think this is something about bridging gaps. Becoming a leader or moving forward is always moving to a higher level, to a better future, something that is our goal. But sometimes we do it on our own, and sometimes we take others with us. So what is public health leadership? What is, how does it differ from leadership in general? Before, maybe leadership, maybe you have read some articles or heard different discourses where policymakers and colleagues in the area of health were saying there was no leadership, or there are no leaders, it's not enough, and so on, and that's why we often fail. But now we observe that leadership is everywhere, and we often talk about leadership. I would also like to say something about developing public health leaders, and at the end, I will conclude with transformational and compassionate leadership. So do you agree to this plan, with this plan? I like interaction, so if you have some thoughts, great. If you have some thoughts or ideas, just show or even unmute yourself and say something. I really appreciate that. That is not disturbing. I like human contact.
So thank you very much, Kasia. This is Gauri from Goa.
Hello,
Sangha.
Gauri.
And excited. We heard a little bit of your talk last time, and it was very disappointing to have it interrupted. So very excited to actually be hearing about this, completing the talk today. And I hope at this time my internet works and not yours, because I'm having trouble in Goa, but fingers crossed.
Okay, Gauri, I'm so happy to see your face, and thank you for this introduction. It's great. It feels more personal. Thank you so much. And I, just for the colleagues who were not here last time, I couldn't show my PowerPoint in a proper mode because I have here 2 or 3 screens. And then I realized that I have to disconnect from the university system. And today I am on my laptop. So concerning public health, yes, public health is dealing, and we are dealing as public health leaders with complexity. And we could see that during the COVID pandemic and see how everything in the system is interconnected. Something happens, even if you think about your organization or the decision you make in your unit, how it impacts other units, areas, people, and that's what happened with COVID. So I would say that being a leader, you need to be a system thinker. You need to see the whole system, not only elements and parts or silos in which you work or for which you are responsible, because you need to see everything as a whole and be able to foresee where things will not work or where things can collapse or something may happen. It is just to think about, because I would say interconnectedness is a kind of value, ethical norm in public health leadership. This is a nice article, by the way, that you can read later when you have time. So I started last time with taking you on a journey when we think about leadership, and I will repeat that again. And it is really a journey, and we talk about different levels where we are moving. So we usually start with personal leadership, so leading self. And this is something that we can say willingness of our own willingness to explore our own aspirations, our limitations, to recognize who we are, what values we represent, what we stand for, and how our value system impacts others, and how it impacts our decisions, leading self. At the same time, when we lead ourselves, we also need to have some managerial skills and the willingness and ability to structure and control our work. Who is on the personal leadership level? I think we all are. It's the whole life that we are on this level. And then if you move further, you move to the second level of leadership, which is interpersonal leadership. And often in leadership theory, we talk about willingness and ability to lead others, formally or informally, in a small team, in a group. And we realize that we can have influence on how people work in a small team. And we have to open ourselves, yes, and be open to these interactions, social interactions. And probably you know leaders that are afraid of people. They close themselves in their offices. They work through secretaries. That means that these are not leaders because they don't listen or they are not open. So who is on the second level of leadership? In leading a team, leading a group. Yes. And then you move forward, and then you may be leading other leaders. So, for instance, you are at the university. So if you are a dean or you know, the provost or rector, depends how you call it, and you can have chairs of the departments, and they are all leaders, and you need to lead leaders, so colleagues, the same as you, yes? And then what kind of skills and what kind of leadership capabilities are needed from you to be successful in leading colleagues who are confronted, just like you, with complex systems and complex interactions. Yes, that is a different type of leadership, more of exchange, more of experience sharing and learning. Who is on the leading other leaders level? Is there anybody? No? Patty. Okay, good. Thank you. And then you move forward, and maybe you will go to the last level here on this scale, leading organizations, institutions, or leading systems. In order to reach this level, you actually need to have the competencies on all these levels which are below, right? Is there anybody leading organizations, leading systems in this group? Do you aspire to move to this level? Just think about it. Okay, Sveta, thank you. What is your position? Okay, we leave it like this. Right, so
just to say,
leadership.
sorry, Kasia, it's me again. I would say there are some people here, you know, in this team, in this audience today. So for example, I lead a group in Sangath, which is a child development group. We have Patty here who leads not only the youth group, but also the executive council of Sangath. So I think we do have people. I think Shweta is leading a group, you know, around community engagement. I don't know who else is on the call, so I'm sure there are other, but we do have, I mean, I wouldn't say we've got organizational leaders here at the moment, but certainly people leading important elements within the organization, Sangath.
Very nice, very good. So I'm sure that it rings some bells and resonates what I'm saying. Good. So now leadership and public health leadership, and this
Hi, is there something wrong? Because I think like I'm not able to hear anything, and I think
she's
I think we've
disconnected.
lost Cassia. Yeah.
okay, okay. So we just wait for a couple of minutes.
Boy, she's really got bad luck on this.
I don't know.
Yeah.
Something happened. I was thrown out, and I don't know if that was the problem at the Maastricht University. Yes, I think it was the problem at Maastricht University. So I'm back. Just please confirm if you hear me.
Yeah, we can hear you.
Okay,
Yes,
I
we
will.
can.
Yes, very good. So there are some people that are known as leaders. Can you just tell me what some specific characteristics of their leadership style are known, and especially these two people? So Mother Teresa, what was the specific thing that we call her leader globally? Compassionate, okay. Compassionate, good. Okay, empathy, inclusive, right. And what about Gandhi? What was he recognized for? Peace, non-violence, values. All right, great. Very good. And yes, I can see. And then there are other leaders. You see, for instance, Mandela. What about him? Okay, determined. Yes, exactly. Determined, yes. So no matter what, yes, no matter what, he persevered. He hasn't changed and kept to his values. And what about some disruptors like Steve Jobs? Is suddenly disrupting and challenging people. Yes, you will not win if you don't do something that is, that will change the universe suddenly and disruptively. Or some new strange entrance into the leadership, like this young girl from Sweden, yes, Greta, whom young people consider to be their leader fighting for climate change. Yes, something totally different that we would expect. Or just people who bring help. Yes, people where you don't need to know their faces. They are leading, they are helping, and that's also part of leadership. Or Zelensky, he is also a leader, and in what way? He doesn't leave his people. Yes, he's always with them. He didn't leave the country. He stays and supports. And there are also women leaders that were quite well written about during the COVID pandemic. There is a nice article in The Guardian which says that women leaders were able to deal with COVID pandemic in a better way than men did. And I'm sorry for all men who are in our group today, but why? I will explain why. Because they said that women were able to embrace compassion and science together. So this seems to be a very strong combination for a leader, being compassionate and at the same time rely on evidence base. I also like this New Zealand Prime Minister that you know that she resigned from being a minister some time ago. Do you know about that? Yes? Have you heard about it? I have to see what you write. Yes. Okay.
Yes.
And I must say that it is really an act of courage for a woman to say, I am tired and I have done enough and now I will do something else. I really appreciate it because she was able to divorce from power. And very often leaders just are so, you know, once they get power, they can't divorce. They don't see right anymore. You remember Trump, how difficult it was for him to say, enough, I leave. Any comments from you? Okay. There are also leaders who are celebrities, yes, and they try to do a lot in a different difficult situations, war zones, etc. And the Mother of Hearts that you know as well. So helping, and you see there is this compassionate element, openness for other human being. And I think this is something close to the people in India, because you have such models. And from what I heard, what you do, what kind of groups you lead, it must be close to your heart. So leadership is a well-known concept, and the definitions of leadership are also quite well known. And it is something like the process of influencing others to understand and agree about things that need to be done, that you go together to reach a shared objective. And the most important thing is influencing. So actually leadership is to be able to influence others as a role model, or with your value system, or with the way you treat people, or with the way you introduce innovation. You influence others that they want to follow you, that they want to be with you, and that they are proud that you are their leader, that they are proud to be associated with you. But what is public health leadership? And there is a difference, although all these leadership aspects relate, but in the area of public health, leadership is to make sound public health decisions and then implement the changes necessary to achieve the public health benefit. And you know that it is the case. Also very true in the area of mental health. It rests on achievement. So you see its influence, but here you achieve. You need to achieve with the focus on prevention of disease rather than treatment of disease. So that's how it works. And here I want to share with you the study results, and we wanted to define public health leadership more in depth. So I carried out the interviews with public health leaders. These were the leaders from the European region. And based on these interviews, we came with the framework. And as you can see here in this framework, you see a core category, which means that all of these leaders wanted to benefit society and improve health and well-being. So like in the organization, they want to maximize profits And in health, you want to benefit society, improve health and well-being. The most important factor is the context. Yes, someone is saying something? I don't hear. Was someone saying?
I think somebody unmuted by mistake.
Yeah. Okay. So if you want to say something, just raise your hand or just speak. You see, public health context, and here the context is important where you are a leader, where you work. Is it a small community group or team? Is it the interdisciplinary healthcare team? Or is it a hospital? Is it the low middle income country, or is it a developed country? Where? So where is the context? And they were talking about emerging types of leadership. And these were some new type of leadership that is more horizontal, more participatory, including many actors and many sectors. And I'm sure that you know, in order to achieve public health benefit, you often need to cross these bridges to go to other departments, to other sectors, to other disciplines, to bring people together. So I know that some cultures are still very top down, but for health, we need horizontal leadership, that you need to bring these stakeholders together so that everybody is heard. We were talking about inner path of leadership. So this is the values, ethical leadership, that you are steadfast to your values, that you have courage to act and professional will to do things. You have content matter knowledge. That's the essence of leadership. And what they all expressed is that a leader nowadays has to support people development, facilitate education and training of your colleagues, connect science, policy, and practice. So be a respected coach and facilitator. And of course, have respect for cultural diversity. So I just highlighted some of the aspects that were very specific to public health leadership, but I think in general, nowadays, this is a trend. And that was not enough, because leadership is rested on diversity as well. Yes, you need to have respect for diversity. So what I did, I interviewed women leaders. And I interviewed 40 women leaders from all over the world, from different countries. And this is what it shows. Again, context where women work is important. But the core category for women was balance. And it is not only work-life balance, but women have a problem with, but women pay attention to balancing things. So sometimes, and I think all women recognize that, it is hard to strike balance between being tough and being weak. Yes, being strong and being weak. Also, balancing priorities. So what we choose to concentrate on, yes, and what we take as our responsibility, sometimes too much. And where is the balance? I think you recognize that, ladies, those who are on in the meeting. So that's very interesting with this balance. But they were talking also about inner path of leadership. So again, values, responsibility, human perspective, empathy, and too fast. And they were also talking about being able to see a big picture while multitasking. So taking a few different responsibilities and still doing a job. And women are flexible with setbacks. So if something doesn't work, if we fail, we get up and move on. And they are always ready for change. So if in the team you have a woman, it's good to start the change process with the woman. We are change makers, problem solvers. But there are also a lot of barriers that we encounter. And these are barriers related to diversity, barriers related to culture, age, gender, lack of access to professional network, lack of support or mentoring system, and lack of confidence. And women are often marginalized because they are not confident, and this is not trained in women. So what needs to be done? There are barriers, and this is another study that we have done with my PhD student. We were looking at barriers to women leadership in healthcare, academia, and business. And this is based on the systematic literature review. And look, these are all the barriers that women can experience. And this is gender, lack of family support. So, for instance, the ladies that I interviewed from Arab countries, they said that they wouldn't be where they are if they haven't had the support of their male family members. Yes, there is something like glass ceiling, and you know that. But do you know what is glass cliff? Anybody? Do you know this barrier?
Sorry, Kasia, what did you say? A glass what?
Cliff. It is number 9.
Oh, well, it sounds dangerous.
So what is it? Do you know? Can you think of it?
Oh, I personally have never heard this term before.
Okay, so for instance, if there is a woman in the team or in the organization, and the organization doesn't have a plan for that woman, or wants the woman to fail or not to progress on the career, they give her a project or task that she will never succeed.
Patty with us knows about this. Setting up a woman for failure, she said. Okay, that's
yes, setting up a woman for failure. Yes, it's exactly glass cliff, right? Yeah. So lack of, and then the rest, you know. Do you know tokenism? It is 25.
Yes, we know. I just wanted to say, you know, Kasia, just for you, you know, just as a little bit of background, Sangath, in terms, it's, I think I'd love for other people to talk about this. But we have a very strong women's workforce within Sangath. You know, we are mostly women for whatever complex reasons. I think it is partly the structure of a not-for-profit that women are more engaged in the work that we do. So I'm just finding that, you know, what you're saying is terribly interesting. Thank you.
Yeah, very good. But you see, women constitute the majority of workforce. Yes, that's 80%, sometimes 70%, but only 3% of women get to the CEO positions. Yeah, this is based on the European reports and so on. So there are women, yes, but CEOs or these high levels are not for everybody. And in many countries, there is a big pay gap between men and women, and so on and so forth. So you know about this. Good.
That is completely true for the corporate world in India, for sure. Like every single friend or colleague of mine who works in the corporate area complains about this. So for every 20 men leaders, there will be maximum of 2 women leaders at the higher positions.
Yes. So, you know, there are different programs.
I'm sorry to reflect, but also, you know, Madhu, just to add, so it's not just the corporate, you know, if you look at the legal system in India. So if you look at the chief justices in the Supreme Court, for example, there are 2 women at the moment, I think. So India is quite a strangely interesting place. We are, you know, we've had a prime minister who is a woman. We have a
president.
That is
a good example.
Yes, we have currently a president who is a woman. We have state leadership that is women-led in West Bengal. But I think it's often, I mean, I don't want to say it's tokenism, because these women all get there with much work and with grit, but it's still, it's still a very male-dominated world.
Of course. But why these things that I'm showing? Because we need in education, it's not just to know that there are these barriers and what women feel. We need in leadership, we need a mentoring system, education and training, and access to networks. When there are networks which are, male networks or some networks that you will not be able to reach, you have to start your own. You have to develop your own. And from what you say, it seems that there are a lot of women and they are prominent and working. So just build your power and people will ask you. So you need to think of introducing education and training, and also in emotional intelligence. And this is so strange, because women are generally very emotionally intelligent, but we don't know how to use these skills for our advantage, how to use the emotional intelligence, to manage very well. And one of the ladies that's Sally Davis, she's the chief medical officer from NHS in the United Kingdom. I interviewed her and she allowed me to say what she said. And she said that when she first had the training in emotional intelligence, that was a new world open for her. And that really women leaders have to be trained in that. So it's just for you to think about. So now I move to leadership in all policies. So you see, leadership is extremely important, as now it was not talked about. So now it's everywhere. And we did a study with my colleague on trying to find out what kind of leadership competencies are important in fighting COVID. And of course, there were things such as epidemiology, preparedness, science. But on top of that, very important was leadership. But you see sensitivity as well. So in crisis, we need a combination of these skills. And to show you that now all important European or global policy documents include leadership as a core value, or everything is around leadership. So leadership in member states, leadership in the way we deal with problems, challenges, we do research, etc. So I would say that leadership is now in all policies, like we say health in all policies. And there's this example from Maastricht University and also from the Netherlands. And that might be interesting for you, because we know that today the need for leaders is too great to leave their emergence to chance. Dutch universities came up with a new policy. And this is room for everyone's talent. They wrote the paper, and now universities introduce several areas for scientists to grow. So, for instance, it's obvious that you have research, education, or impact, but you also have leadership. And you can aspire in your scientific career with your publications, PhDs, etc., to become a leader. So that and when we talk about few women that get to the top positions, so if you have something like this in your policy, then you can start from the beginning with a vision that this is where I want to go. And the organization should be supportive. So it's a very nice thing. If someone is interested or is in the organization level at the university, I can share the links with you to look more into this. But look, we were also involved in the development of core competencies in applied infectious disease epidemiology for something like CDC, but European Center of Disease Control. And look, leadership competencies feature very nicely and are included in this very specific type area for epidemiology. Laboratory leadership competency work framework. Laboratory would say, oh, laboratory work doesn't need leadership that much. But yes, it is a very strong component of the framework. And then the WHO asked for competency framework, which I had privilege to lead on. We developed a framework of competencies for public health leadership, and we wanted, not leadership, public health in general, but we wanted to show that competencies are intersectoral and interdisciplinary. So we didn't silos them, but you see they are all together, like content and context, relations and interactions, and performance and achievement. And then when you open them, you see in the content you have science, practice, so all these specific methodologies, statistics, etc., demography. Then you have promoting health, law, policies, and ethics. One, health and security, so forward-looking approach. And then you have relations, interactions, and you have leadership, system thinking, collaboration, advocacy, culture, and performance in achievement, something that relates to how you manage in the organization or organization. So it is professional development, it is governance of resources, human resources, financial resources, etc., and also organizational literacy and adaptability. Just to show you one area, leadership and system thinking, because we are in the, yes, and then you have some competencies. For instance, yes, facilitate development of other leaders. And we also show these competencies across levels. I don't show it on the slide, but we have level 1, which is novice, then level 2, competent, and then level 3, expert. And each competency is defined across levels so that staff, that workforce can evaluate themselves, or you can use this for evaluation of the workforce. So we are talking about developing other leaders, that it is important, and leaders have an obligation to develop other leaders. And I was looking also with my PhDs and how leadership is taught all over the world. So there are different definitions of leadership, different frameworks. Sometimes leadership is as a part of a wider program or framework. Sometimes it is a little module in the medical curriculum. So there are, you probably know CANMEDS, because generally in medical education, it is one of the frameworks. Very often there is a mixture or misunderstanding between leadership and management. And you know that failing organizations are usually overmanaged and underled. Micromanagement is very destructive for the organization and achievement. So there are a lot of these frameworks. We use the leadership frameworks. It is also part of my research activity, where we identified through systematic reviews and expert interviews the areas that need to be taught in public health leadership, and this includes system thinking, political leadership, ethics and professionalism, emotional intelligence, etc. So, and each of these areas also describes the competencies and the levels. For medical leadership, clinical leadership, this is maybe something for you. It's also a very nice tool. It is from Leadership Academy, NHS, British model, you see. And then they have competencies and they have different lights. So red lights, that you need to work on it, but there are competencies and it is used for self-assessment. So if those of you who are interested and you are in clinical field, you can also look at this area, you see, working with others, developing networks, etc., etc. So there are different frameworks. There are also specific frameworks and specific courses in leadership that relate to challenges. So there was something like a pandemics leadership framework or refugee health curriculum framework, etc., etc. So they appear based on the current need. So the general question is now, talking about leadership, what to do to move from good to great. And what does it mean? From good, highly capable individual to level 5 leader who builds enduring greatness through a paradoxical blend of personal humility and professional will. And this is very important that here the word paradox is used. You see? Because public health leadership is a paradox, and I will explain.
Have we lost Kasia again?
I think so.
Yeah, looks like it seems to be hung for her, whatever.
It's again, I think it's Maastricht University. I'm very sorry, but my colleagues from the room next door.
You're back with us.
Yes, I'm back with you, and I'm sorry for this. You see, that's bad. Okay, do you see? Can you see?
Yes, yes.
Yes.
Okay, good. So the transformational leadership is about inspiration, inspirational motivation. Yes, you talk about the importance of having strong values and beliefs. You consider ethical and moral consequences of your decisions. You articulate a vision, and you build respect in others. You act as a role model. And what I said at the beginning, you make people feel confident and proud that they are with you. There are a lot of different leadership styles, and transformational, servant, and system thinking called complexity theory. These are the three styles that are most important and work in health. Because there are a lot of this great men theory, trade approach. They are good, but they don't really work in healthcare. And these three really are for you. And it has been documented and evidenced. But above these three is compassionate leadership. Compassionate leaders captivate hearts and deliver results. And I would recommend, if you are interested, there's two books. You can buy, I think, on Amazon, Compassionate Leadership. That's British, and it is really related to healthcare organizations and how to be a compassionate leader. And bottom line is compassionate leadership. This is more general, but very good, and I think they will be helpful for you in your practice. Generally, compassionate leadership is about this process. First, you pay attention to others, you notice them, you attend. Then you try to understand through listening, dialoguing, and creating shared understanding. Then you respond in an empathic way. So you feel the relation with other human being, but please pay attention without being overwhelmed. I go back to this balance that sometimes we want to help people so much that we put ourselves down and then we are overwhelmed taking care of other people's problems. That's not the case. We have to be very careful not to do that, but to listen to people and help these people take care of themselves and then helping. So in these books on compassionate leadership, you will see what to do as a leader in each of these areas. But you have to have open mind, open heart, and open will. So to conclude, what is leadership? Yes, it's constant bridging, moving. You need to be able to challenge status quo. You need to be a competent expert, enable others to act, confident, inclusive, sensitive, self-reflective learner, trusting coach. But I also said that leadership is a paradox. Yes, you need to be able to live in a paradox. On one hand, courage, on another hand, humility, humble. On one hand, you need to be strong, and on another hand, you need to be vulnerable, or you are vulnerable because you are only a human being. On one hand, you need to be sensitive, but on another hand, you need to be tough to be able to say something. So it is living in a paradox. But remember that you need to have heart, head, and courage to act. Thank you very much.
Thanks so much, Kasha. We'll take questions now. Yeah.
Yeah, we have 6 minutes.
Yes.
So, are there any questions?
Go ahead, Gauri.
Yeah, thanks. So that was a great talk. Thank you so much. So I have a question about when mentees do not perform. So what are your personal tips? I think as a woman, as a leader, there are complexities that we're all trying to navigate in a very patriarchal world. But sometimes there is this issue around, you've mentored a person, you've tried as hard as you can, but you know that things are not going to work. And I just would like to know, if you've ever been in a position like that, and, when do you close shop as being, a mentor? When do
Yes,
you
I understand.
Yeah.
There are many situations like this, and yeah, there has to be a mutual understanding, and sometimes you need to maybe let the person open, is to find out where the problem is, but not that you try to find the problem, but the person does. I use a GROW model to check that. Do you know this model? This is a very nice thinking model that sometimes helps. GROW meaning goal. So what do you actually want to achieve? What is your goal? Then R stands for reality. So what is your current situation? What is the reality? Yes. Then what are the opportunities? O stands for opportunities. Yes. What are the opportunities that you can take? Is there? And then what would you do? So this is simplified what I'm saying, but the conversation is around these issues with the person. And you try the person to think and come up with this answer. Sometimes it helps.
Thank you.
Anything else? I see something in the chat, but I don't know. GROW model. Okay, go reality, opportunity. What would you do? Good. My question: being a leader, how should one minimize the fear of failure in team, especially as a servant lead? That is something that you shouldn't be fearful about. The fear of failure, just because the most important thing is the confidence, and that you share openly with others what you are going to do, based also on the feedback of other colleagues. And that the COVID pandemic is the situation that the decisions had to be taken although sometimes there was not enough evidence to take a decision, but people expect that from you, yes, and you do your best. And if you fail, never put it under the carpet. If you fail, admit it. You see, I said that a leader is in paradoxical situations. So on one hand, strong, you take decision, but then you fail. So what? You say, I'm very sorry. I wanted to do my best, but it didn't work. Shall we do it again? Will you help me? And by saying something like this, by admitting that you are that you failed, you actually make yourself stronger and stronger, and people start trusting you. So don't be afraid. And don't always want to appear strong. To ask, how can one build on their professional will in an environment that lacks mentorship? Okay, build first, that is something that I often discuss with my younger colleagues and so on. And they suffer because they are not recognized, that they have to do things that are not that important for them, or that they have no access to things they would like to. I always say at the beginning, build your kingdom. Learn, learn, and learn. Read, write, try to contact with people. There will be a moment that in the discussion, you can take a position, but not at the beginning, at the end. And say something that matters, that is counted, yes? And that people, wow, yeah, we want to have that person at the table. So there may be no mentoring, but when there is no mentoring, you have to do it on your own. But never push, because also when you push and you want very much, then people don't want to help. So I don't know what else. That's beautiful suggestion. Okay, so are we ready to finish for today?
Does anyone have any other questions? Asha, do you have, if no one has any questions, can I ask one very quickly? If you have
Yes.
time. Yeah, you talked a lot about emotional intelligence. So can you just tell me a little bit more about the importance of that in leadership?
Yeah, extremely important. There is, there is a lot written about emotional intelligence, and there are models of emotional intelligence. It's the ability to recognize the influence and impact of your own emotions on others, and recognize the emotions of others, and to manage your social relations, to manage your personal relations, to manage even your career or the work that you do. So you will never make a good leader if you don't know how what you do, what you say, what you believe in makes impact on others. The name, the person, the psychologist who coined the term emotional intelligence is Goleman. Goleman. Yeah, you know Goleman.
Yeah.
Yes, you are a psychologist,
Yeah.
psychiatrist.
Yeah.
Yes, so you must know it. And I think it is a very important aspect. But emotional intelligence can be a separate training. So I would say there are helpful. There are also scales and tools. You can find them on internet. And I think as psychologists you can have access to this. And there are some scales, and you can do self-assessment on how emotionally intelligent are you.
Okay. This is something
Mother, can I just come in?
Actually, yeah.
Just to say, of course, real thank you to Kassia also, but just to state that as an organization, having had this talk, I think it's not enough to stop with this, this wonderful presentation, but actually to have some introspection on who we are and whether we are providing a mentorship amongst, for our junior colleagues. And I'm wondering whether, a couple of people attending today might actually want to lead this going forwards. Just a simple initial red cap, questionnaire to people who are working about whether they feel they're being mentored, whether there's leadership that's supporting them, and then really thinking in a very structured way about how we strengthen this within Sangath, I think would be just a fantastic output for us.
That's great. That's great. I would like to be involved.
Thank you,
That's a
Kasha.
great suggestion. I think that's a great
Yeah.
suggestion, Gauri. So maybe we can like connect offline to kind of set this up.
I also
I
saw that
feel like
someone
we
has done a
have,
study.
So we talk a lot about some of the qualities that Kasha has spoken about in leadership. We focus a lot on some of them, but maybe not enough on others. So we need to reevaluate how much of what we're doing is actually.
Yeah, and I think it's also,
you know what I mean? Like,
I totally agree with you, Madhu, but I think it's also a organizational issue. It's more than individuals. I think we need to ensure that Sangha as an organization provides mentorship to everybody. And it doesn't matter whether you are the cleaner who comes in, or whether you are, the driver, or whether you are the top researcher. I think there should be a sense that there is a pathway to mentorship for everybody. Because I think in some ways it's also, I understand that, we're talking more about research mentorship, but it's also about just being an organization that listens, which I think should be important.
Very important. I see that Priyanka has done the study on emotional intelligence. Maybe it is something that you can share, Priyanka, with others and see. I also have done a study on emotional intelligence and public health. So I will be happy to hear what your thoughts are, and and let me know. It was great pleasure to meet everybody. Can you just open your camera so I can see the people behind? Just for, okay, everybody. Hello. Hello, hello, hello. Hello. Oh, great faces, great people. It's so, it's so
if
nice.
we're making this effort, somebody should take a screenshot.
Yes, so let's everybody, hello, there's one man, I see. So I was talking mainly to women, that was, okay. Everybody, please open your, and take a shot. Matt, will you take a photo of us?
Yeah, I'll do that, yeah.
Great.
Great.
Yes.
Thanks so much, Kasha, for giving, for coming twice.
Yes, coming twice,
and,
but there is something wrong with internet in Maastricht. I'm very sorry for that, but also at homes we experience something. So maybe because of bad weather.
But it's always reassuring for us in India when this happens in a very high-tech first world country. So we feel very smug and superior for a few minutes.
Very nice. Yes, well said. Because when I go to sometimes countries that I would expect they don't have good connection, they have much better than here. And look, I'm at in my office with my office computer and internet, and the internet is failing. So goodbye. Wish you a nice day.
Thanks, Kasha. Take care, everyone. Bye. Thanks for coming.
Bye.
Bye.